And welcome to Professor Bogart's PNR 204, which is pediatric nursing. I do live in South Florida. I'm in Homestead, and I used to teach at the Cutler Bay campus. I taught pharmacology, I taught pediatrics on ground. I've even done some community, and I've helped with med surg and whatnot. I am one of those very weird nurses that does adults and I do children on the highest level. I've done adult open heart surgeries, ICU, trauma, ER, and I've done children, congenital heart defects, newborn ICU, PD ICU, and then trauma in an emergency room for the last 10 years is what I did. So background is all over the place, adult and children. And you are going to get that information as we go because up to this point, you're taught all about what happens to adults. Well, now it's children. So I'm going to try to teach you the differences between looking at an adult or looking at a child, looking to assess that child. How do you know if they're going bad or not? What's the vital sign for that child? What are those differences there? Okay. So I will be inferring that all through the lectures, and you're going to see I try to explain things in a manner that make it understandable for you. And I'm also going to try to make it in a manner, that I put some real life experiences in there and like, oh, I can see it. I can understand it now. And I think that will make you get these topics. Now, today, and the way that I teach is I'm going to do a PowerPoint. Now, at any time during a PowerPoint, and I'm sitting here, I'm lecturing, and you don't understand, tell me, maybe that was you, your child, something. Do not hesitate to talk. I don't get upset. I don't get angry. It doesn't, disrupt me. If you have a question and I'm not explaining it correctly or fully, you don't get it, again, please just stop me. If you don't understand, I'm sure somebody else doesn't understand also. And I know some of you are shy and some of you aren't. I mean, that's just, people and personalities. So what I do is a PowerPoint. And I go over it. I don't read a PowerPoint. So you got the PowerPoint. I'm going to highlight it as I go over it. I don't sit there and just read the words. I don't think that that gives you anything that you need, but explaining what the concepts are behind that, it'll help you get through this course. Then after I do a PowerPoint, I'm going to be doing a Kahoots, if we have time. Sometimes we do, sometimes we don't, but you always will get that. Now, way that I do the Kahoots, you will see the concepts you're going to see on quizzes and exams is going to be on those Kahoots. Okay. So it's something that you can, with your partner, one of your classmates, you can Kahoot back and forth to each other, and test each other and talk about whatever, if we're talking about something like, hypothyroidism and signs and symptoms of in a child, like, oh, hypothyroidism. Oh, this was the answer to that question, but what more could I think about that child, right? And I think two or three of you getting together doing those things, it can only but help you. Also, if you're that student who is a repeat or is a reentry, I want to meet with you every week, right? I want to make sure that you get through. And we only can do that by making sure every week you're getting the concepts and topics that we're talking about. And I'll work with your time, okay? So that's not a problem with me. Um, uh, we'll arrange a day and a time, evenings, morning, well, late mornings, in the afternoons, and I can get with you and help you through. So today we're just going to quick go through that online about the course and what's expected. Now, a lot of these expectations are right in your handbook, your student handbook, employee handbooks. It's all part of it, but sometimes you don't see it explained like this on ground. So I'm going to tell you when assignments are due, when there's the deductions, what you need to do if this happens, and then the one thing I want you to take away from this, if there's any issue and you can't get an assignment done, or you can't come to class for an exam because you whatever, you need to notify me before. Before. Also, if you're going to be absent because of an illness, Remember, absenteeism 20% can decrease your letter grade by one full grade from an A to a B. But if you have documentation, I was in the ER, I was at a funeral, I was at my dog's whatever, it shows us that you were somewhere. You send that to me and to Dr. Brown. Some of those hours can be waylaid, and you're not going to get that grade decrease. So again, good communication back and forth, right? Talk to me before. Also, the other thing is a lot of times with online, all about your connection goes away. Also, power. Do you bring the cord home? Is there electricity in the house? I mean, all of these things. If there's something that's stopping you from finishing an exam, a quiz, or coming to class for those things, again, let me know. I've actually gotten those text messages from the power company. The power's down. It should be up around this time. We accept those things. So let us know, and we can make sure that you get everything you need. All right. So let's start with the online course. We always do PowerPoints, our um, study guides for all exams are in PowerPoints. And the other thing you're going to see on the handouts is a week one handout. That's going to be next week's quiz. Okay? You got a handout for all your quizzes. So when you start coming to class next week, the first thing you're going to do is take a quiz. And it's on this week's information, and it's about week one handout that you already have. Okay? So that's how you study for your quiz one. So online, again, we know that it's a little difficult. Actually, I learned a lot about students, even being online and not on ground. You just need to talk to me, tell me what's going on, and I can help and guide you. If you're getting confused, frustrated, anxious, I can work with you. I can calm you down, and I can help get you straight to get you through. I mean, you're in pediatrics already. Literally, there's one more quarter of capstone. You're at the end, and you should really commend yourself for all the hard work that you've put in already. Now, if there's a problem and you can't get a hold of me, I am your online professor. There is a lead pediatric professor, and that is Professor Stiles. If I'm not getting a hold of you, make sure, and you're not getting what you need, talk to her, Professor Stiles. She's always available also, like me. Then let's say none of us are getting to you and it's something you need to know, or you're upset, something's bothering you. I tell you, please call Dr. Brown. That's her phone number. I'm here. It's also her email there. Let her know your frustrations, what's going on. You tried to get a hold of me. You tried to get a hold of Professor Stiles. Nothing's happening. Now I'm reaching out to you. She wants to see that you've gone through that proper chain of command. Okay. Now, as you communicate, remember, don't put caps on, to write your whole message. That's perceived as yelling at people. Remember, we're professionals. You're going to be professional nurses. And with that being said, you need to know how to present yourself in that way. And we start expecting that in school, and how we express our needs, our wants, our desires, our frustrations, and we'll work with you. We've got a really good team. Know that it starts at 3 o'clock, 3 o'clock, 5:30 on Wednesdays, and it will go to 8 o'clock. Now, I have one question to ask you. Many classes like to get out as early as they can because it's the end of a day and you're tired. Now, we do get a break. We get 10 minutes for each hour. You are allowed a break according to your handbook. So that's 20 minutes that you have, that I can give a break, or I can get you out early and have no break. Now, I don't mind if you have to go to the bathroom, get something to drink in the middle of class. As I said, just put it in the chat box, going to the bathroom, getting something to drink. So I know where you are. Okay. What would you like to do? Leave early or have a break?
Leave early.
Leave early.
Leave.
We have a class after.
Leave early,
All
please.
right. Oh, good. Then you can have a little bit of time. All right.
Leave
I will try to
early.
get out as early as we can within the guidelines of the program. Okay. It's all right. No problem. I don't mind. It doesn't bother me. If I have to get up and run to the ladies' room, it's a 5-minute thing, but usually I'm okay. Discussion questions. Your first one was due today. We have your introduction and your discussion question one. The first part is due by Wednesday at 11:59 p.m. Eastern time, and it is the two peer responses are due by Sunday. Um, your discussion questions, some students don't really care for them. Some students like just to cut and paste and not really pay attention. I will warn you, a lot of questions out of quizzes and exams are out of these discussion questions, the concepts that are there. So make sure if you're doing those sort of things, put it in your words so that you're explaining it in a manner that you're going to remember. Okay, because remember, it's not just putting information and getting an assignment done, it's learning because in the end, you have an NCLEX to take. And you're going to be alone sitting there thinking, and you're not going to have Dr. Google in front of you or any other thing, right? Standards of professional conduct. We know that, students tend at times get frustrated, feel they have to take shortcuts in order to pass the course. There's cheating, there's plagiarism, using things and materials that you shouldn't have access to, or forging assignments. All these things have been done. This is nothing that we're suspecting. No, these things have all been done. What I'm telling you is if you are going to cheat, you're going to plagiarize, you're going to alter things, go to websites that I know all this information is sitting on, they do go through and monitor these areas very, very closely. And most of these things do go through plagiar checkers, and I send them through plagiar checkers. So if you're going to use some other work, make sure it is an APA, the reference, and put it in your words. Okay? Just change it up a little bit, change a word, and that will get you what you need. I don't want anybody that I have to report for plagiarism or cheating or anything. I don't want that. So just be aware that I think that you'll all be great nurses and you need to take what grade that you've earned, okay? Not all nurses are A nurses. And I want to tell you, I was not an A nurse as a graduating nurse. I was a C nurse. I just barely made it by. But I am a great nurse. I'm one of the best nurses that you will meet, and they still are talking about me and I've made an impression, wherever I've worked. So just let you know, you don't have to always get that A. Do the best you can and don't get frustrated. I've had students say I got an 86 on an exam and I'm frustrated. Well, pediatrics is not easy. It is a high level med surge 2 course. So know that, if you get an 80, I'm happy. It really is difficult. Okay. Code of conducts, we know you're going to, do things the right way. These are some of the websites that I was just talking about, the Sudoku, Course Heroes, Stuvia, and there's a lot more. And we know that you're there because we can see it. Or we can see that the words that you're using come right out of there. We can see a similarity check. So please just don't do it. Do your own work, and you'll be a lot better for it. All right. And if you're not getting it, not understanding it, that's why you have me here. Now, homework. Remember, your syllabus is your Bible. When the syllabus says it's due, it's when it's due. I have put in all of your assignments when they're due and when, up to what date, which means if it's due on Sunday, like this week's discussion question, and whatever you get, you'll get that full grade, whether it's a 20 out of 20, 18 out of 20, or 16 out of 20. If you don't get it in by Sunday, you will get 10% deduction and then get the grade that you were deserved. So if you were supposed to get an 18, you might just get a 16 instead. You see what I'm saying? That is 10% of it off. And this is any assignment. Now, NCLEX questions are open. Discussion questions are open. CJ Sims are not. They have to open the week that they're due. So some of you like to work a little ahead. Be careful. Don't submit them ahead. All right. Because sometimes you're not getting enough hits on your website that shows attendance. So be careful there. I mean, but I did give you that extra because I know you want that and you need that. Again, attendance is live sessions. You know, the one thing I can say is you all came on with your names. I've had iPhones come in and Galaxies come in, or the child's name, husband's names, but it looks all of you have the proper name on your Zooms. I want to see that. Number two, I want to see your full head. I don't want to see a forehead at the end of a class, or just you're coming off the camera this way or this way. All right, very important. I've seen a lot of ceiling fans in my career, no ceiling fans either. And the reason is because accrediting bodies are really, really stringently careful and cautious with online courses to ensure that nurses are getting proper education, which is great because I'm not going to give crappy education. I'm going to teach you, and I'm going to teach you the proper way. All right. So this is what is required of you for this course, always online. Now, some of you are like, do you have to wear your Fortis uniform all the time? Well, there are professors who like that. I just don't want you to be half naked. I don't want you in your pajamas. I don't want you in a tank top. Give me something a little bit appropriate. All right. The other thing is attendance. We said it's 15 minutes. 1 minute late is 15 minutes late, or 15 minutes 1 minute clocking out late is 15 minutes taken off time. So be careful there and know that if you don't come to class and you don't show up, nobody's communicating with you. In 14 days, they don't have to notify you. They can drop you and remove you from the course. The other thing is what I was saying is attendance can't be made up, but you can explain it in case you're up to that 20%. There are some quarters that everything that happens to its students between being pregnant, having babies, having deaths, fires in the house, burglaries, all this to one person, and how do you keep up with that? Well, communicate with us, communicate with me, communicate with your deans. And if what's going on, we will work with you. We don't want you, to get frustrated. And believe it or not, there are a lot of resources that you don't realize that you have that Fortis has, for things that could happen. All right. So always communicate. All right, attendance, you know that I do that. We know 20% will come off, and you're going to get emails 5%, 10%, 15% attendance loss. So, key to success. Well, every week I will put up, like, it will say next week, week 2 information. And under that is going to little talk. It's going to tell you what chapters, and it's going to give you any of the information you need, any handouts, any PowerPoints, anythings every week. Now, to follow this class, I will put out one that says week 1 recording. And in that, I will give you tonight's recording. I'll give you the links to the Kahoots. I'm giving you an extra one because the theorist, we'll go into that later, is a big thing. I want to give you an extra one just to practice on those things. And I'll be sending that out by 7 o'clock tonight. I mean, I try to get it out as soon as I can. There's some students who want to listen to something right away, and some students aren't going to listen to it till whenever. But at least I have it up and available for you, okay? Now, on that to-do list is all the work that's due that week. All right? If you see a 0 in your grade book, go to that assignment. If it's a CJ Sims or an NCLEX, maybe you did them wrong. All right? So maybe they'll have another chance to hand in the correct way. Especially like, for instance, the first NCLEX questions are all about growth and development. It is a separate section in the NCLEX, Saunders NCLEX book, okay? It's not pediatrics, it's growth and development. And some students go to pediatrics and try to give me that and not what I want. And that growth and development is very important because that's all exam 1. So a very important thing that they get them done. So I'll put a 0 in the grade book, but I'll put in the bottom, this was the wrong questions. Please submit. I might even send you a picture and do it this way. Or talk to me. We can meet on Zoom for 2 minutes and I can show you how to get there. But again, work with me and I'll help you. And I'm not going to take off that first time, but it must be in by that following Sunday. So that's 2 weeks you had on that assignment. Always look at your Canvas shells. I don't send out a lot of announcements. I'm not one that sends out 10 a week. So not me. If you get a message, there's something important in there to read them, okay? Because I know you have a lot of classes. I'm not that one. No. If it's something specific to you, it'll be a specific message to you. Hey, did you forget the discussion question? It's due by Sunday. Or hey, it is Sunday. Did you forget your NCLEX questions today? A little reminder, and I will remind you. Remember, each NCLEX question is 1.25%. Each CJ Sims is 5% in this course. It's big, and you don't have any written assignments here. That's all you have. So it's not, this is actually, in that regard, homework is easy in this course, but the course is not easy, okay? Again, to be successful, all I have to do is say, keep in contact with me, period, and I can help you. So how do you get a hold of me? Well, I'm going to give you my cell phone. It is in the website, but it's 305-951-8055. I do answer it pretty quick, unless my grandson has stolen my phone and is playing Roboblox somewhere. Actually, I do have my phone and answer it. I'm actually, when you want, go and send me an email at bbogart@Fortis College or just message through Canvas. I get back to you pretty quickly. But I'll warn you, if I don't, something's wrong. I missed it or it didn't come through, send it again. If you don't hear within 8 hours, something's wrong. Send me that message again, okay? Because I'm usually pretty quick. When you come to class from now on, it would be nice if you looked at the PowerPoint that I send you up for like week 2. That's giving you the first exposure to the information. You come to class. I teach you that PowerPoint, what it means. And maybe you had some questions about that PowerPoint. That's the second time you've seen that information. And then I'm going to do a Kahoots. And that's the third time. So now you've seen these concepts 3 times before you even leave the first class. And that repetition is what you need. Repetition, repetition, repetition. And it does make it stick in there. I know there's always areas that I don't get. That's where you come to me and let me explain it in something differently for you. Anybody who wants tutoring, I have no problem. I'll work with you. Whether you're an A student or a C student, does not bother me. You want help, I will help you. If you want to know about the quizzes and the answers, I can't give them till the following week, but I can meet with you and go over quizzes. Maybe it's the beginning of class. I come about 10 minutes early. You want to go over some of those quiz that you said, Whip, I don't know what that answer was. What was it, Professor Bogart? And I will tell you what the answer was, okay? That's up to you. Again, you're in an exam, you're in a quiz, your computer shuts off, turns black screen, and you can't get back in. What do? Call me first. Call me first. You can get exams restarted on ExamSoft. Quizzes I can reset. Just call me first, okay? We do tutoring as an exam reviews the week before an exam. So week 3, we will start exams. What day during the week is good for you to come to a live review? Do you like Tuesdays or do you like Wednesdays? 4 or 5 in the afternoon? Do you like Thursdays?
Tuesday.
Tuesday? Anybody else?
We all have class Tuesday, Wednesday, Thursdays. Well,
You
most
want
of
a
us.
Friday? If I do it Friday, will you come Friday?
I can do
Clinicals on
Friday
Friday.
On
like
Fridays.
Clinicals
maybe
on
before my
Friday.
class.
Time
It
All right,
depends
give
on
me
the.
a time what you like.
after, like around the same time as we have the class because of work. I don't know. Who else is
Well, if
okay?
we have class, we have class. I can't do a review and a class. It has to be a separate
No,
time.
no, I'm not saying that. I'm saying about Friday. At the same
Okay.
time we have class, if everybody's okay or they can.
You want Friday at 5 o'clock?
I work until 4 o'clock.
All right, so 5 o'clock, 4:30, 5:30, what time?
I would be at work. I would have to like step away
Now, if
for a
you're at
bit.
work, you're at work. No, the one thing, Whitney, I record everything. I record classes, I record exam reviews, and my exam reviews will be posted. And the other pediatric professors, and there's 3 other ones, all of their reviews will be posted on the same announcement. So you can listen to a different view, a different way of explaining the concepts. A lot of students like me, a lot of students like somebody else. It's okay. I would do 2, always 2, me and somebody else, and that'll help. All right, well, then we'll look at Friday, and I'll look at Professor Stiles and see what she says too, because there is a Friday class, and I don't want to miss one. So let me see what I can do for you, okay? But I'll do it later in the evening. I think that's what I'm hearing by you, Emily, correct?
Yes. I will
Okay.
contact you directly. Yes.
Okay. We know that there's a KGA, there are exams, there's quizzes, and there's a HESI. And you add them all up, they have to equal 78.0. If it is 79.9, you were not successful and you did not pass the course. Once you get that 78, they add in the homework assignments. We don't have Kaplan anymore. We have discussions, we have NCLEX, we have practice exams. And one thing I'll warn you, number one, they're worth a lot of points. You've heard that already. At least get the minimum 78 on it so it doesn't pull down your KGA. Okay? Because you can fail not doing homework properly. Homework can fail you. Warning, warning. That's why you're going to see me sending message, hey, you didn't do this, you didn't do that, hand this one in. This, it's minus 10% now, whatever. I'm trying to help you. I'm not being a pain. I'm not scolding at you. I'm trying to hold your hand. I'm trying to help you and trying to help you succeed here. Now, the first weeks, 1 through 5, all of the homework grades are turned off. After the whole week's homework grades are turned off, we turn them on around week 6. Because week 8 is that cutoff date where you can drop, right? So we show you how homework affects you positively or negatively, and you can do something to change it by that point, all right? So we turn them on week 6. We turn them back off week 8. And I wait till the end, almost to week 9. I want to show you how that pediatric assessment project affects you. So it's usually the first day of week 9. I'll turn off all the homework so that you saw how that will affect. Once it's turned off, it does not get turned back on until it's the end and it's your final grade, and HESI is remediated and everything. We know all about that. Remember, when you come in on quizzes, I don't have you come in on 2 devices. I put you on one device looking at me, and I'm going to do a physical check of you, your ears, your wrists, making sure that it's safe, and I'll be monitoring you. You come in on Zoom, and there is an access code for the quiz, so you can't start it till I start it. No quizzes, no matter what the excuse, may be made up. Okay? It is one question. And it's like they figure it's 1.5 minutes per question. So it's 10 questions and it's a time for 15 minutes. Now, what if you have accommodations? You need to let me know from Elaine Foster. I need that letter. and send it to me, and I'll send it to Dr. Brown, and you'll get extra time on quizzes and that extra time on exams or whatever those accommodation letters says, okay? So those are quizzes. Remember, you can't just sit at home, not have your computer on and do the quiz and, get a grade. You must be on camera, proctored during exam. Even if your screen turns black, I'm going to try to get a hold of you with chat. I'm going to try to talk to you to get that, say, hey, could you turn on your camera before I give you a 0? I'm going to try hard, but you have to be on camera. Be aware. Every now and then pick, okay, my face is still on camera. So the exams, we know they're on ExamSoft. We know you must come in on a second device. ExamSoft, as I said, any problems, technically just stop. There's a way I can actually check every single click you've done on your computer. And I know the times that was happened. So when you send me a message, it will correlate with what time the technical problems occurred, okay? Make sure, the one thing I see, don't forget your charging cords and make sure that your devices are charged. That's the biggest thing that I do see. As I said, quizzes can't be made up for any reason. Now, what if you are 77.9 and you didn't get a quiz done because you were in the hospital or you with your mother in the hospital or whatever, which was a real excuse. And you can show documentation. In the end, you can send a message and to Dr. Brown, and you can say, I feel that I should be able to make up this quiz because this is the documentation, and she will let you. Okay. But overall, in general, something happens, you don't get to the quiz on time, you're not going to take it. This is why I do my quizzes beginning of class. The quiz is open from 5:30 to 6. Some of you are just getting home from work. I don't shut off the Zoom and I don't lock you out like some professors do. But at 6 o'clock, that quiz is gone. Okay. Just to let you know. So that if you are that coming in late person, number one, make sure you're muted so you don't disturb the other students. Send me a message. What's the access code? And you can go ahead and get it done. A lot of professors don't do that. But I understand 5:30, you come home from work, it's the traffic. I live in Miami. Hello. You can't get more traffic than down here. Right, Shamika? It's like Turnpike heading south to Homestead is like crazy anymore, depending on which way you're going. So I understand. So that's one of my gifts to you. All right. Accommodations. We talked about it. We've talked about Zoom. We've talked about, all right. Happens if you wake up the day of an exam and you're having major GI issues. You got a migraine, you can't see, end up in the ER, your mother had a heart attack. And all of these things have happened. Let me know before the exam is due. I can tell you, no, relax. When would you like to do your exam? Let's do it another day. You will not get 10% deduction as long as it's not every single exam you're doing that to, okay? And we can make it another day. Now, something happens, you don't call me, you don't show up for an exam, it will be minus 10%, all right? So again, keyword, communication, right? So if you have a problem, let me know and we can waylay your exam, but it must be done before the next class. So before next Wednesday, if today was an exam, you would have to get that exam done. All right. And we can work together with that. Some of you like to proctor on campus, which is okay. But you have to have the proctor email me and you have to tell me. And it should be on the same day and time as class, if at all possible. If not, I just make up a different exam for you and they'll have that if that's what you have to do to work it out. Some of you can't take exams at home because if too many kids are destruction, everything going on around you and you can't concentrate. I understand that. And you have to go to campus. That's fine with me. Just let me know. And again, I'll work with you. All right, we already talked about that. Exams, quizzes. Quizzes are right through your modules. So next week, I'll tell you, go to week 2 module, and there's quiz 1. And you click it, and that's how you get there, and I'll give you the access codes. Simple. Open for 15 minutes, it goes forward, it does not go back. Once you answer a question, it's gone. We already know all these things. SE exam. SE is given at the end of week 11. It's given on your campus, which means I have no control on when you're going to take your exam. The campus is the one that will make the schedule, okay? If there's a problem with the scheduling of the HESI, you should notify your campus. And I'd also notify Dr. Brown so she knows that there is something going on. So maybe she needs to make a global decision of changing something. All right. And we know we want everybody to get a 900. We know they're difficult. That's why we're going to try all quarter long to get the best grades as we can on all the quizzes. So you go into that HESI not feeling so tense, and I'm telling you, that's when the grades come out really good. When you're not worried and concerned that you didn't get your 84 on that HESI or whatever it has to be, okay? There is remediation when we're done. One of the things I see with remediation is students love to do well all quarter long. And then they're in 3, sometimes 4 classes I've seen on the PN side. And you don't study for peds because you need a 30 to pass on the HESI or whatever it is. Well, what happens then? You take the HESI and then you get a 500. You have 12 hours of remediation time. It would have been easier to study a little bit than it would be to do 12 hours of time. Okay, so just remember that, and I would like to see good HESI grades. So, and the thing about HESI is that you all as students don't realize, the professors, all of us, we look at the HESI, print out all this, numbers and whatnot. And it shows us the concepts where you were good at, according to national results, and also what you were weak at. And with that, I have a good understanding. Oh, I need to put more about this into the lecture or more about that in the lecture. So if you're doing an exam and you didn't study and you're just answering whatever, I'm not getting a true, clear vision of what you need, the future nurses, the PNs, okay? So that's why I encourage you, do the best that you possibly can. You need your ID. And again, always talk to me. Homework, we've talked about it, planning it. Again, I'll be talking to you. You know when it's due, you know when it's late. NCLEX questions must be presented, submitted accurately. And you take and you print results, put it into a PDF, and that PDF is what attaches. Okay, Whitney? It is, you take in that bottom right corner on that green box, print results, all right? When you went to save it, you're going to save it, not print it. And then when you go to the assignment, you can upload that NCLEX questions into Canvas Shell, okay? Any questions, you have your LRC can help or I can help, just let me know. Remember, those first questions are all growth and development, all right?
Okay.
All right. NCLEX questions, there's 50 questions, there's 4 of them, and they're 1 week before your exams. You can do them as many times as you want, but once you submit it, that's your grade. You can't redo them. Like if you need that extra points at the end because the homework grades were low or whatever, and you need a little more, I can't let you redo them. So give me the best grades you possibly can, all right? That's why the grades go off and on, so I can let you see how you're doing. I don't want anybody to be left behind. In week 10, you have 2 assignments. It's pediatric HESI assignment, practice exam. This is through the modules, and they're 40 questions, I believe, each. And these really help you with the boards, all right? It's through the modules that you do it, and you should get it, the grade, upload into your grade book. If it doesn't, let me know and I can go search the site. Sometimes I can find it. CJ Sims. If you've never done CJ Sims before, you go through them. Now, the answers are out there. I'm aware of this. Go ahead, put all the answers in, don't read it, and guess what? You've learned nothing. These CJ Sims really go into big concepts. It goes into newborn issues and goes through it and tells you what to look at, what's important, what can wait, what has to happen now. And again, is you're becoming a nurse, right? Starting to think. So try to do the best you can. You can keep redoing it until you want. You do it 10 times if you want. But again, look up those diagnoses, look up those medications. And when you're done, I'm telling you, it does help you. These CJ Sims are actually like little mini case studies that are going on here, right? When you submit, I need your name, the name of the patient you've done, the date of the assignment, and the score. There's a printout page in the end, okay? If you don't know what it is, find somebody who does, go LRC or let me know and we'll figure it out, okay? But I need all of those 4 things on that form. And each CJ Sims is 5% of your grade, week 10. Telling you, that's the big one. You don't have any paper assignments. We have NCLEX questions, discussion questions. Again, you have references that need to be on there, and you need to cite your references in the body of the paragraph, all right? So make sure that you remember your book is the biggest, Lafer. That's your biggest reference of all. Of course, you're going to go to your book and look this stuff up. Now, all of these questions here are Dr. Brown. And she equates education to you functioning as a nurse on a job. As in, if you were late for a medication, or you were late for a treatment for a patient. Or if you didn't get an assignment done, you didn't do a treatment, right? These are things the way that Dr. Brown thinks. So again, number 1, communicate. Let me know what's going on, and then if we need help with those concepts, ask me and we can meet. And that's the online portion of this stuff. Any questions? All right, we are going to do infants and toddlers today. Any of you have children?
Yes,
Infants and toddlers?
not a toddler. Graduated. He's 5 now.
Oh, he's a 5-year-old. He's a preschooler. Okay. My little grandson's going to be 8 on Thursday. You're going to hear all about him in the class. And I do have a new grandson who's 20 weeks in mommy so far. So I'm going to have 2 little boys and they're close to home. So happy for that. I love kids. Something I always have. Yeah. So in each chapter, they're going to go over and put all of these objectives. And if you could go through and see some of these and figure them out, they're good. But again, everything is here within your PowerPoint. Terms. Now, on the exam, you're going to have some definitions. On your exam, you're going to have theorists. On your exam, you're going to have growth and development on that first exam. So a lot of these terms you're going to see. Now, before the first exam, I actually hand you out a Word document that you can fill out. And I'm going to give you a PowerPoint study guide where all the answers are that you can transfer. So again, get the the study guide, the PowerPoint. You can transfer, okay, this is what those answers are, and come to the review or listen to it. And now that's what 3 times you've already looked at it. So again, it's that repetition, repetition, repetition. So development is the progressive increase in the function of body. Cephalocaudal. Well, cephalic is what? Head, right? Cephalic. Caudal is your feet, head to toe. development. Well, what does that mean? Well, about an infant. An infant's born at 7 pounds and they can't even lift their head up. They can cry and coo. And we teach them to suck and swallow while they're breathing. That's the first thing they learn. By 1 year old, they are walking, talking, tripled their birth weight, and have grown, about 8 to 10 inches in the first year of life. It's amazing how quickly. And it's that head to toe. What do we do first? You lift our head. What do we do second? We turn over from our abdomen to our back at 5 months. At 6 months, we turn from our back over to our abdomen. At 8 months, an infant will sit up unsupported. By 9 months, they should get up and be on the side of the couch, like creeping around it, right? And by 1 year, they should be attempting or they should be walking. That is head to toe, right? I went from lifting the head to walking on my feet. That is cephalocaudal. Proximal distal is we start out with things from the center of the body and then we get to go outward. So we only see things here and now we start to see things around us. Proximal distal. Growth is the way they grow. One of the things we do in pediatrics, every single time you go to a doctor, urgent care, ER with a child, they get a height and a weight. We don't do that for adults anymore, do we? Oh, I can lie all the time. I don't weigh 200 pounds. I mean, I'm 130. I've been there forever. Yeah, not. But that's what I'm saying. Adults, we don't. Because does height and weight really, most of the time? No. That's only if you have issues. Children are growing so quickly, the height and the weight, we got to make sure they're growing the way that they should. Not only does nutrition affect it, but all of those endocrine and hormones, the pituitaries and whatnot, all do affect it. That's why we monitor the height and the weight so closely here. Now, maturation is the way a person grows and develops as dictated by inheritance. You're going to mature and grow up the way your family is. You know, your cultural influence, absolutely. Am I my mother? Well, sort of in some ways and not in others. But yeah, it is dictated. That's what brought me to be who I am today. So the difference between adult and children, adults are continuously growing and developing. The growth spurts, we do a big growth spurt and we sit there, we gain weight and we grow again. It's up and down and up and down. Now, we know that when we're with a child and we're doing an assessment on them and we're looking at them, why do we need to know all of these different growth and development dates and times and when do they do what? Well, if they're not doing what they're supposed to be doing, we need to plan accordingly, as in let the physician know, let the charge nurse know that we can institute early intervention, or maybe they need to run some tests. Maybe something's wrong. If they're not rolling over by 9 months, something's wrong. They're not sitting unsupported by 1 year, something's wrong. So again, we have to be aware of that. Another thing, remember, children and adults are different. And we need to remember, adults, we go in, we do it, and that's it. Kids, there's that prep that's getting on their level, gaining trust, and then we have to get all of that stuff done, right? Data collection, as I said, height and weight, very important, and we're going to be looking at that. So whenever we're looking at any sort of concept, we want to look at the nursing process. We've heard that, right? We've heard, let's get the data. Height and weight, no increase from 6 months to 9 months and weight. Something's going on, right? So that's our first thing they're looking at. Analysis of nursing diagnosis. So determine, according to parenting needs. So I would say child less than expected body weight related to decreased breastfeeding as evidenced by not gaining weight properly. It's as simple as a nursing diagnosis could be. All right. So we got into that. Planning. Now, what am I going to do? What am I going to do to change that behavior? Well, I'm going to tell the parent about feeding the child. Maybe, they have reflux or something they're not talking about. Maybe they need medications. Maybe they need to thicken cereal. Maybe they need to supplement, increase calories and formulas. There's all sorts of things that we can do there. Okay. And then once we initiate whatever the physician tells us is the best way to get that weight up, because without fuel, nutrition, a child and cognition, they're not going to grow. They need fuel for the brain. All right. So once we get all of that done, we're going to evaluate it. Now, we know that the mother now is feeding that baby properly. You're going to be gaining weight now, right? Weight gain is going to be more appropriate than it was at that 8-month visit when it wasn't enough. All right, there's some nursing processes here, and I want you just to go over and think about those things. I gave you a really good one to start with. Now, assessment tools, things that we can use for developmental screening. Now, on your PowerPoints, you do have these little things that you can click on. There are a bunch of YouTube videos. You want to go and look at them. You don't understand it. You want to understand it more. Click on them. I'm not going to do that in class. It's something that not every person needs every single video. So do it. Now, a Denver developmental screen has nothing to do with telling you your child is autism or anything. All it does, it identifies that the child needs some sort of therapy, some sort of help. We look at personal, social, fine motor, language, and gross motor. If they're not where they should be, this tool will identify it and say, we need to do something. It is not an IQ test. It's just saying, do I need other therapies to get this child up to be where the other children are? And you know what the greatest thing about kids? They're resilient. They catch up so quickly. As long as you give them the tools they need, make it fun, make it a game, they're going to do anything you want. Influencing factors. That was a question right off an exam. Following factors are closely related and dependent on one another and their effect on the growth and development of the child. So how are they growing? How are they developing? What are things that make a difference? Well, heredity. Are they going to grow normal when everybody in there is short? No. So again, that's how I'm saying those things. Nationality, race, things that they eat. Do they eat all vegetarian? Do we have to worry about iron deficient anemias? Yeah, growth, development, nutrition. Where are they in the family? The first baby tends to be a little bit more nurtured, and that middle baby tends to be a little forgotten if they're the younger baby. And that ordinal position is what I'm talking about. Males and females are different. Males tend to be a little bit harder than females to get things done. And then, of course, the house, the environment, the homelessness, poverty, all of those things are dependent on growth and development. Growth and development is all about nutrition, nutrition, and nutrition. And if they're not getting it right, all of these things will affect the child. Can we catch it up? Well, remember, nutrition fuels the brain. And if we let it go too far, it's going to be permanent. If we catch it quickly, we can change that by that early intervention. And we most likely can get them caught back up if it was just a nutritional issue going on. Now, there's all sorts of family, and I'm sure you all have your own type. My mother and my father were nuclear. They got married when they were 18 and 22. They were married for 66 years, and they had 7 kids. Me, I'm on my second marriage. I have a boy and a girl. My husband has 3 daughters, and together we have 3, 4, 5 grandsons, 1 grandson on the way, and a granddaughter. That is my extended blended family. Okay. And there any could be 2 males, 2 females, could be grandma and a daughter, grandpa, grandma, and the child, all of that. And guess what? Family is whatever they tell you their family is. There's no right or wrong there. Now, there's all sorts of parenting type. You know, my mother was that absolute authoritarian, strict, inflexible, high expectations, and she was ready to send you to your room. And you're going to sit there for a while. Okay? Again, there's different. Authentic. This is that nurturing. They're affectionate. They tell you what you can do and you can't do, and they help you and they're talking with you. That's the authentic style. The indifferent is that you're into yourself and you're not paying attention to the child, basically. And permissive is something that we really got to be careful of with children. We can't be their best friend. We need to be parents. Yes, we can be friendly, but we're not there to be a best friend. We need to help them, guide them, hold their hand as we watch them grow up and learn all about life and around them. Now, discipline should be focused on teaching rather than punishment. And let me explain a timeout. So, little 4-year-old Rodney, really bad, hit his sister hard the second time after mommy warned him, and mommy's going to put him on timeout. Rodney, you're going on timeout. You hit your sister after I told you not to. After you stop crying and fussing and be quiet, I'll start the clock and you will be on timeout for 4 minutes. You've told them what they did, you told them what was expected, and you gave them the time that they're going to sit there. That is a true and real the way you do a timeout. Nutrition, 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 right? It's all about giving the body everything it needs, the minerals, the vitamins, the electrolytes, the water, the da 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 da. And again, we know that feeds the brain, and you can only have a healthy brain and a healthy child if they're fed correctly. As they get older into school age, they use that My Plate thing and they teach. One thing you got to be aware is school age children are the best group of children to teach because they're thirsty to learn and they're pleasers and they want to learn and they want to know these sort of things, right? So again, sometimes nutrition is different. You know, there are families that eat breakfast, lunch, and dinner, and there's no in and out. And there's some that you eat whenever you eat, and there's no priority around it. Again, children need consistent, good nutrition, or they're not going to be living up to their potential. And then you have the opposite of that, where they eat too much, and now they're an obese child, and now you're getting all that bullying, all of that peer rejection. You know, I can't get up, move like the other kids, and that, you know, can be very hurtful to that child. So, nurse, what does a nurse do? Well, you find which child is not getting nutrition, and then, you know, give them some sort of nutritional plan. And again, the one that's eating too much, what can we do to decrease? Now, when you talk about obesity and children, the first start to figuring out what to do with their diet, give me a food diary. Let me know what that child's eaten in the last 3 days, right? I know now, oh, this is what you've eaten. Maybe this is what I can replace it with. Food diaries are always the first thing on any under or overweight child. So cultural food influences affect an infant or a child's nutritional intake. Well, I've told you one about there are some religions that are vegetarian. And without vegetarian, they're not eating that meat, and it can lead to iron deficient anemia. So one of the things with that is to be teaching is where do we get iron in a diet? Well, green leafy vegetables is one of them. So these are things that we should be teaching our parents. So nutrition and health promotion. We know that children, you should not decrease fat in their diet. And they say up to the age of 2, even if they're overweight. The central nervous system needs calories and needs fat in the brain. So you've got to be very careful putting any younger child on any sort of restricted diet there, okay? Also, what about that child's severe illness? I've had children that had big parts of their intestines removed because they perforated as young infants, and they have an absorption problem with food. And at night, they get parenteral nutrition and sometimes even get it in a tube feeding, that enteral feeding. And again, that's just giving extra calories when we can, because the body's not absorbing it the way it should. Now, feeding a kid in the hospital, well, number one, kids in a hospital, they don't feel good. They don't want to be there. They're scared and they don't like our food. It's all of those things. They're really poor appetite. So, what do you think we can do to help a child eat? Well, I think the first thing here is don't give them anything before meals, like sweet drinks. Like, don't give them their apple juice before their meal. They'll just drink apple juice all day long and they'll forget about eating, right? Also, if they are not eating, is it something physical? Is there sores in the mouth or something? Younger kids can't tell us. Older kids, maybe. Younger kids might be with their tongue sticking type thing, but you sort of look there. Also, 1 tablespoon of food for each year of age is all they need. We think they need so much because of the infant who's just tripled their birth weight and they are 10, 12 inches taller than they were 12 months ago, and how much food they've been eating and drinking and drinking. And all of a sudden they're a toddler and they go down to hardly eating at all. And I think parents, I know my husband had a hard time with my grandson. He's like, he's not eating at all. I'm like, well, what did he eat? And gives me the list. I said, actually, that's more than enough. He said, but I don't think it's enough. It's because when they become toddlers, they're not gaining, they don't need to eat that much because they're not getting that much height in them or weight. They don't grow as fast. They slow down. So they just not to eat as much. And I think that's pretty good. Another thing with ill children, especially infants, many times they come in and they're unable to eat for whatever reason, medical or surgical, or they just don't feel like it. Infants, they need to have some way to soothe themselves. Children in general, especially infants, how do they soothe themselves? How do they explore the world? With their mouths. If you have an infant who cannot eat for any reason, give them a pacifier. That oral in the mouth is what will calm them down. I've been a nurse a really long time. I've seen them, yes, pacifiers are good. No, they're not good. Yes, they're good. But it has come down to some really good research. And they have found that a pacifier is the first line of treatment for pain control on younger children. There was a research study done in Harvard with neurophysiologists, I believe they were called, and they were looking at doing procedures, minor procedures on infants. One group used morphine, the other group used a pacifier with sugar water on it. There was no difference in pain control. The sugar water pacifier was just as good as morphine. So you can see, starting an IV, giving an eye injection, doing anything like that, give them a pacifier and it's going to do them well. Also, those kids who can't eat, give them that pacifier and they do comfort themselves. That soother name is a great one. As I said, childhood obesity, why? Well, we know it's coming along because of they're more sedentary, they're not out riding bikes, they're playing video games. The environment, maybe your community, you can't. We know that problems that start in childhood can become serious problems in adulthood, as in obesity, turning to high cholesterol, high blood pressure, and diabetes, all of those things. So something why we watch it. Oral health. Now we know at 6 months, that's when the first tooth can come in. I don't know any kid who's had a tooth at 6 months. I mean, maybe one. Usually it's somewhere closer to 10, 11, 12 months, and then all of a sudden they get a bunch of them. But it is said, do not neglect the baby teeth. Make sure that they're brushed or just a warm washcloth and just clean the teeth before they go to bed at night. And bed at night, they should have no more juice, no more milk before they go to bed, because that's sugar. It could rot their teeth. All right. And we want to make sure that we get good teeth. If they have pain in their teeth, pain in their mouth, they're not going to eat, right? And we don't want those sort of things. So oral health, very, very important. They say permanent teeth start about 6 years old. Oral care, again, sticky foods stick on there. I mean, we know what sticks, to our teeth. Sugared gum, dry fruit, sugary soft drinks, cakes, candies, those things will just stick in between the teeth. That's why they say, I mean, it's not always done, brush after each meal and snack. As long as they get morning and night, at least they've got it twice. But according to the book, it's after every meal and snack. I mean, if you have 3, 4 kids, it becomes a lot, but it's something that should be done in protecting their teeth and keeping them healthy. Now, dental caries, believe it or not, my son got these that look like that. And it was back, now he just turned 40, so it's a long time ago, but there was no sippy cups. There was no like container top. They didn't have them, they just had bottles. So he would have his apple juice in a bottle with that little nipple, put it in his mouth, and be flinging it, walking around the house with it. And I didn't know. I wasn't working pediatrics then. And his top teeth did get those dental caries. Now, once the teeth came out, his teeth are fine today. But again, it could have been prevented if I would have known. Yes, his teeth were brushed morning and night, but having that all during the day did cause them to have it. Tooth hygiene should start when the first tooth comes up. Replacing the toothbrush, I don't know if we all even do that. After you're sick, you should be replacing that toothbrush. They say avoid rinsing the bristles in hot water. It can make them, the integrity of the material could break off in there, right? And of course, no sharing. Now, there is a misnomer that says a child with a fever has a fever because they're teething. Doctors will tell you it doesn't happen. I'll tell you, every kid that I had who had a tooth coming in all had fevers. Now, they say they're not related, but they say that tooth coming in is not a cause for a fever. There probably was some sort of viral infection or something going on underneath. Now play. What does a kid do from the moment they wake up? They go looking for their toys, right? They eat, they go looking for their toys, and they want to go and start exploring. They want to be creative and have fun, right? Play is their work, because through play, they're moving, learning, running, jumping, crawling, talking, expressing themselves. And this is what we need for them to do. Now, at the hospital down by me in South Florida, the pediatric hospital, they've got this unbelievable playroom. It's an indoor-outdoor place, and they do all sorts of stuff. But it's with children who are non-infectious. If you have a fever, if you have a draining wound with infection, those kids can't go there. But about a sickle cell disease or rheumatoid arthritis, something that's non-infectious, diabetes, they can all go to the playroom. And if they have to be there for a while, it makes it a lot easier. And the one thing which is good is, they do these art projects, and in it can help the child express their frustrations or what's going on in their hospitalization. And we know computer games. You'll always see kids, there's always going to be a computer game. So with toys and play, big thing, make sure that the toy is age appropriate. Make sure that it says small pieces under the age of 3. Make sure you don't give it to a kid under age of 3. Make sure the toy is equal to the child's understanding. So there's a whole bunch of toys and a bunch of things here, and you can match them up. And we know who's going to be playing pool. Well, that's going to be your adolescent for sure, right? So Your answers are underneath that one. You can look at all of them. In infants, again, going over all the things that we're going to be looking at here. So parenting, I think the hardest thing is, we are people and all of a sudden we become, families and we want to have a child and we have our child. We don't know what to do with it. There's not that little rule book in the instruction manual that comes along, and children are all different. And I think the one thing I absolutely loved and still love about pediatrics, no two child is the same. In adults, a gallbladder has the same thing as this gallbladder, as the same as this one with a gallbladder. Children are all different. And that's what I love, because it's making me think and keep me on my toes. Now, there's called an irritable child. These are children that are just always cranky and they're crying and they're gassy and, you can't ever get them comfortable. So, what some things we can teach and we can use if they're in the hospital with us? Well, number one, try to get them in an environment where it's calm and quiet, and it's not bright, it's dim in there. And I'm just sitting there with no talking, and then we have to get up, we have to move, everything slow, no rushing. Infants love to be swaddled, and that means in the blanket where we put our arms up, we get them tight, or they just feel comfortable that way. Then give them that pacifier, and then slowly just rock them gently. Nothing quick, no sudden movements. That's an irritable child. So some children, also, if we are in there doing so much, all of a sudden, again, these kids shut down. And we can call it a lethargic child. It's like they're over whatever's going on. They don't want to be bothered. So again, we almost treat them the same way, as the other child. So the lights, the moving, the calm voice, sitting upright at intervals, look around, at the environment, but everything not so bright, everything quieter and calm. And if we have to change diapers, etc., go slow. This is not a race. Go slow and go easy. Infants should sleep 4 to 6 months, about 4-hour intervals. Hopefully by night they're getting that long sleep so mommy and daddy can sleep too, right? We know that the circadian rhythm needs to be on the families. Now, this is difficult for some nurses. I worked night shift for many, many, many years, 23 years. I was pregnant during night shift. So guess what? It was my second baby. Wanted to be awake all night long and sleep all day long. It was okay with me because I was doing that. But it was difficult for my husband at night because he had to be with the baby when I was working. So anyway, trying to get the child on your rhythm, get them fixed up that way. It's hard and it takes a lot of patience and a lot of sleepless nights. Positioning them should always be on their back. We should never put a baby on their tummy to go to sleep. It's preventing SIDS death, an unexplained death in the first year of life. They have found that babies on their tummies had an increased level of SIDS death than those infants on their back. Now, if they're on their back, parents worry about the back of their heads. And they're worried about that their head's going to be flat. Well, that's why we have tummy time, a couple times a day. And that head is soft. It will round out. It'll be fine. And again, sleeping, they need to soothe themselves. Let them try to comfort themselves. If not, mommy has to, of course, and a pacifier always does work. Immunizations. Now, not every parent gives children their immunizations for whatever reason. They'll say it's religious. But what that does, it increases an exposure of risk of illness and death to everybody else. So the one thing that I would always recommend is if there's a disease, that there's an immunization to prevent that disease from happening, and that disease is a really horrible disease, we should be promoting immunizations to it, okay? And then keeping the good records for it. And it's one of the questions we'll ask on admission. Are your immunizations up to date? Car safety. We're facing up to the age of 2 years old or a maximum weight of 30 pounds. And they actually say in the middle of the car. And we don't, do we? We put it behind the passenger seat because we can see it, right? But they actually now recommend in the middle of the car. At 2 or at 30 pounds, you can turn them front seat. With fall prevention, by 5 months old, children can roll, but they can roll a lot earlier than that. So never, ever, ever leave a child, infant. My little Christian at 2 weeks old turned over for his pediatrician completely, so it can happen early. Make sure that they're in some sort of buckle belt or your hands on them. They will roll out. I've had many a child show up to the ER where they've fallen off the bed onto the floor, fallen off the changing table, off the couch, off the kitchen table, kitchen counter. I mean, I've seen them all happen. So again, tell them that they should be very carefully monitored for falling. Stairwells are a big thing. Make sure they're blocked off, and pools should have a gate around them. I mean, I live in South Florida. I've seen quite a few drownings, and it is not pleasant to see a child go from perfectly normal, healthy to, barely any brain function and being alive. And I've seen it. And it's making sure that we protect our children. Again, the toy safety, like I just said, make sure it's on their level of development and make sure there's no small pieces there. And then let's look at what the kid's doing with the toy. Maybe they need something else. Illness prevention, we know that there's periodic health checks. We know at 2, 4, 6 months, infants are going to be getting their immunizations, and at 1 year, knowing that those are good times for those health checks. That is our time to teach our parents and our children things that they need to know. Educating them about changing their diaper, diaper rashes. Diaper rashes are one of the biggest things that wake children up at night. So we want to prevent them. We want to get our sleep, and then let's look at the growth, development, and then of course, with education, making sure what is the diet? What are they eating now? What's the normal day? Being on top of those things. Physical assessment, they actually do a hearing test before they're discharged from the hospital today. We're doing visions, we're doing those growth grids, we're doing all sorts of immunizations. Nurses are doing nutritional counseling, and then any other questions that they have. My son was 6 months old and was sitting up, but my daughter, she's 6 months old and she's not doing that. And oh my goodness, she's behind. No, all children grow differently. No two are the same. So developmental milestones. We know that there's a sleep-wake cycle. They'll be asleep for a couple hours, wake up. We know that goes on. We know that children do have a smile. They do have a coo. We get to the point where they can drink out of a cup, even though they're little, because there's a cup that's not going to spill all over them with a little thing, and they can suck it out of it, which I think is great. Now, what is separation anxiety? Children are smart. Infants have you right around their little finger and you don't even know it. They are some of the smartest beings. And separation anxiety is you show them a toy and they like it, or they want to look at it, and you hide it. So the toy is not in visual sight. That infant still knows it's there and will actively go search for it. So separation anxiety is something that we will have. Now, children, you're going to have a discussion question on separation anxiety, and there's several stages of it. What if you were a kid in a hospital and mom had to go home and daddy's working and he had to go home for 2 days because of whatever. Now you're with the child. This child's going to be screaming, yelling, going crazy, aren't they, at first? And these are these levels of separation anxiety. After they realize they're not coming, they tend to regress, maybe start sucking their thumb again, or want a bottle when they've been on sipping cups for a year, or maybe they're potty trained and now they're incontinent. These are all things. And then what happens is, if they're gone for a long enough time, what happens is when the parents come back, the child doesn't want to go to their parent. You know why? Because they don't want to be hurt again, because they know the parent's going to leave again. The grasp reflex. This is all about fine motor skills. F fingers, fine motor skills. Grasp reflex is when you put your finger next to a baby or a rattle and they have a reflex, not voluntary. You touch their palm and that hand comes around it. And you'll see most mothers go, oh, look, my baby just gave me a hug. They squeezed my finger. Don't tell them it was a reflex. Let them think that their baby did really give them a hug on their finger, okay? Parachute. Ever take a kid, turn them over to their tummy and put them down in a crib and they put their hands and their legs out? It's a reflex that starts about 7 to 9 months. Like the cat that you want to put them down and they come with their hands and their feet up. Same sort of concept. They're protecting themselves. And then we have the grasp that comes from voluntary. It comes from reflex to voluntary. And then they get into taking little Cheerios off of the high chair and just one at a time. Starts accrued with a bunch of them, and then it ends up fine with just one going at a time. So emotional development. Now, this has a lot to do with Erickson. Now, in this exam, there's like 9 questions, all about theorists. One of the theorists is called Erickson. I'm going to send you a bunch of information on it that you can look at, all right? I'm going to try to explain it in manners that you can understand. But again, it's that reinforcement. So I'm going to send you a bunch of these YouTube videos that I do have that was I got from Professor Stiles, which are excellent. What is trust? What does an infant know is trust? They cry. What happens? Somebody goes, picks them up. That's my trust. What happens if, for whatever reason, the infant continuously, on a continual basis, cries and nobody never picks them up? What is that? That is mistrust. When does mistrust happen? Well, it could be in an abusive relationship. It could be drugs, alcohol. It could be homelessness. It could be a bunch of different things. But it's a mistrust. A happy, healthy baby is somebody who trusts. That is that calm baby, all right? Now, one of the things, and I think even me as myself, as a brand new grandparent, having my grandson for the first 3 years of his life live with me, I wanted this kid to do everything all at once. And, he was and still today, he's smart, he's in gifted programs, but is trying to remember that we have to give the child their way of learning a chance, and that we have to let them, and we can't force learning on them. They won't learn. We can show them, we can encourage them, we can praise them, all right? But, once they're, letting us know they're ready, that's the time when we introduce new tasks. All right, here we are. First year development, it's a whole bunch of stuff. Birth weight doubles by 6 months, triples by 12 months. You always see questions about that. Birth length increases by 50% at 12 months, and it's 1 inch every month for the first 6 months. A lot, right? Posterior fontanelle, the one in the back, that soft spot. By 8 weeks, that closes. They start smiling about 2 months. Now, we think they're smiling earlier, but I think it's just gas. All of a sudden, you see that little side of the cheek come up, but probably gas. You can think it's smiling. They turn to their head when they hear something about 3 months. The moro or startle reflex. That's when you make a loud sound or you hit the crib and they jump, hands up, feet up. That's moro or startle. That'll disappear about 4 months old. They completely turn over by 6 months, play peekaboo by 6 months, and then maternal iron stores decrease by 6 months. So we're going to need to give more iron to that child now, right? Remember, at birth, up to 6 months old, all they have is breast milk or iron fortified formula. At 6 months, we start feeding them food. And this is the reason, because their iron supplies have gone down. And now we want to give them iron in different sort of nutrition than before. Also, the belly, the gut, the GI system cannot tolerate food up to about 5 or 6 months. For their fine motor, they should be able to transfer that rattle from one hand to the other about 7 months. That stranger anxiety, like they don't want to go to strangers, like they turn around, they don't want you. It's about 7 to 9 months. And then depth perception. Well, let's go back. At birth, each eye works separately. They don't work together. So this eye can focus here and this one can focus there, but they don't know depth perception, so they have to work together to get it. So by about 9 months, what I'm saying is the eyes now are working together. So now we know the depth perception a lot better. So unsupported sitting by 8 months, crawling at 10 months, that fine pincer, that Cheerios off the high chair, 10 to 12 months, bye-bye at 10 months, walking with assistance or not between 10 to 12 months, and by 1 year old, they should be saying one word, mama, dada, or nana. I actually got a nana at 1 year old. I was so happy. And we know, how does an infant explore the world? Number one, in the mouth, oral, right? And then, of course, that tummy time, moving around and looking for things to play with. That object permanence. Now, theorists, these are hard, all right? You're going to get them confused. I'm going to try to make it an understanding that you're going to get it. And again, make sure you re-listen to the study guide tape because I go into it again. So that repetition. Freud on an infant, Freud on any child, and each theorist looks at different level children. There's infants, toddlers, preschooler, school age, and adolescents, okay? In Freud, Piaget, Erickson, and the others, they will list what they think a kid should be doing at these levels of growth and maturity. At birth, oral, that's from birth to 1 year old, that infancy, it's all about oral, mouth, right? It's all an infant knows. Suck, swallow, breathe. Put it in their mouth, and I feel better. When it gets to toddler, it's actually anal. And it's all sexual. Freud is all about sex. All right, so something sexual has to be Freud. It's anal because potty training, and you bowel train before you potty train. They can actually feel the stool before they can feel the urine coming out. Now, Piaget is all about learning. So I told you about the rattle. It was a reflex grasp if you got it first. Now, oh, I like that rattle in my hand. Then it's voluntary. Let me grab that rattle. So now it's voluntary because I've learned, well, Then the rattle moves and I hear a noise. Oh, I like that. So I keep rattling it. I'm learning. This is cognition. They didn't know how to do this before this. Then they put it in their mouth. So this is Piaget, any way of touch, sight, taste, hearing, and smell in the way that they learned. And it has to be concrete. They have to experience it before, or they had to see it before. Concrete, solid, you can touch it, feel it, smell it. That's what I use for concrete, okay? And then, as I said, Erickson, trust versus mistrust. My trust is baby cries, somebody goes at them, and mistrust is when consistently nobody's going to pick up the baby when it cries. Nutrition, we know at birth, these children's digestive system isn't working, it's immature. They usually say we're not going to give any foods up to 5 or 6 months, only because of the tummy. Their saliva is minimal, and their tummy is still not digesting the way it could. And we also know that as we introduce foods during this first year, we have to be careful. We have to protect that GI tract, one food at a time, one food at a time. And you wait 4 to 7 days before you introduce another food. Now, how would you know the digestive tract didn't like that food? Well, vomiting, diarrhea, gas, farting, burping, cramping, legs moving, crying, rashing, all of those things can show that, can it? So, nutritional counseling. Now, one of the things is called the excrusion reflex. What's an excrusion reflex? You see that tongue on that little baby sticking out? Imagine them sitting up, me trying to put a spoon of food in there. What does an infant do first? They don't know what to do with it. And out comes the food, right? And eventually they learn how to open their mouth and take it in. Excrusion reflex is all about, I don't know what to do with that thing, because all I knew how to do was suck, swallow to breathe up till you started to feed me. I got to learn how to do this one now, right? We know their GI tract is getting better. And we know that around 4 to 6 months, they can start munching up and down and munch. Now, I'm going to do anything with chunks or things. What's the first food that we give an infant? First food that we're going to give is rice cereal. And why is it rice cereal? It's the least allergenic. So you have less allergic responses to rice cereal. Rice is always a choice in almost every diet that we're going to go into as we go further into some of these diagnoses. Now, how did we know the diet's working? Well, besides all of that right there, isn't it the height and weight we do first? It's the first thing I'm going to look at. What did they weigh last visit? What do they weigh this visit? Are they gaining weight? Are they gaining too much? Initially, an infant's going to lose up to 10% of their body weight. They're soaking in water for 9 months and they absorb it. And when they're first born, we're weighing all of that. They go to the nursery, they get their bath, they come back, they look like a totally different baby. They're not as puffy and they've already lost weight. So the first week, they don't gain it. Well, then all of a sudden they start gaining weight like crazy. Now, one of the things that we need to teach our fed parents, mothers, is that, let's say they were in a hospital and for some reason they had to give a bottle and they were measuring formula or breast milk. And now all of a sudden they're going home and they're not measuring it. Like, how do I know the baby's eating? I don't know how much they took. And as long as a baby is having at least 6 wet diapers a day, they say 6 to 8 wet diapers a day, breastfed babies actually have a lot of stool. It's just part of what they are. A lot of stool will come out also. So if after feeding a baby goes to sleep, you're satisfied. So that's how you determine if the diet's working. We know breastfeeding is probably the best that we could do for our infants. Not everybody can do it. I know that I tried for a month and there's no way I couldn't. And unfortunately, back then, we didn't have breast pumps. Today, they've got those great breast pumps that I know with my grandson, my daughter, she's a realtor, so she's in a car a lot. She would be going down the turnpike, pumping her breasts. I have it covered up because that's when she had to do it. And she had to keep the pumping going to keep her son with her breast milk. So human milk is the best. It gives all the antigens and antibodies that the mother is producing to help that baby fight infections. And breast milk is what it should be what we get. But as I said, for many reasons, a lot of mothers can. So what else? Iron fortified formula is what we do give. At 6 months, we'll start introducing that food, as I said, one at a time, every 4 to 7 days. And at 1 year, we can wean them from formula, wean them from breast milk, and give whole milk. Not skim milk, not 2%, whole milk. They need the fat for their central nervous system, for their brains, up to at least age 2, minimum. Contraindications to breastfeeding. You're like, can everybody breastfeed? Well, if you have galactosemia, phenylketonuria, HIV, chemo, medications are the big things with pregnant women. If you have to take pain medicines, or if you're on antibiotics, or if you have seizure disorders and you need, all of these things must be looked at very, very, very closely, because a lot of it does come out in the milk. And that's what this basically is talking to you about. Bottle feeding, remember when we're feeding, using the things, make sure that we clean the bottles well, store them well, use clean water. They've got buckets of water that they use. And again, expiration dates. Just because you just got it from the grocery store or wherever doesn't mean that it's not expired, okay? Never, ever put it in a microwave. I would take water, heat it up in the microwave, and then put the bottle in the water from the microwave, and then slowly, rotate it and check it, because babies burn really easier than us. So don't microwave it. And they say not to save formula from the last feeding. What happens is bacteria from the mouth get into the milk, and it can create bacteria, and then it could cause problems for diarrhea. Prebiotics and probiotics, these are just the GI tract and keeping them healthy. Children who get diarrhea, what they'll tell you to do is to keep the fluids. They'll tell you to keep feeding the baby. Avoid chocolate, spice, sodas, high sweets, and they'll be giving that child some probiotics. And that's the treatment, and keeping the fluids up with that Pedialyte or Gatorade or Powerade. As I said, feeding, it's 4 to 6 months. We know that their sucking is better. They can munch up and down. That prehension stops. As I said, rice cereal is the first. Another thing that some parents tend to do is put food, cereal in the bottles. And they say you shouldn't do that, because they want you to measure it more carefully than that. All right. And put the food, try on the back of the tongue, because that tongue's sticking out. It's like you said, one food every 4 to 7 days. Make sure that they're not having any sort of allergic responses to it. And one of the some of the things that create a lot of allergies: orange juice, fish, nuts, strawberries, chocolate, and egg whites. The first time Christian had a tree nut, his whole face blew up. And now he just touches it and his whole mouth blows up. So he's highly allergic to tree nuts. And again, he didn't have it till almost 2, but you're going to have children. The one thing that I always do as a grandparent, I always carry Benadryl in my pocket for my child, for my grandson, or anybody else who might be out there having an allergic reaction. Weaning. When do you wean breastfeeding? There's some mothers who breastfeed to ages 3 or 4. It's a decision. It's a personal decision. Is there right or wrong? No, unless there's a medical reason. Maybe they just want to, nurse at night. That's their comfort before they go to bed. It's something that, as I said, it's a mother's decision. Usually what happens is they don't want to be held like that anymore. and they start getting teeth and they start biting the nipples. This is when you know maybe we should give up the breastfeeding. And as I said, you start with the daytime, slowing them down, just give night times and, go from there. They also say you can give fruit juices around 5 to 6 months. Remember, no juice, no snacks before they eat. And they get food before they get milk, before they get juice, as you're giving them their diets. As I said, fats, they need it. Just don't try to hold it back from them. And we know that they need it up till about 2 years old. Organic and natural foods, you'll see those labels are more expensive. What they say is there's no guidelines, regulations in them. There's all these things that make sure that they're the healthiest, purest things. Are they more nutritive? It's a parent choice, okay? And the only thing I could say is just because it says it's natural and organic, read the label, because you don't always know, all right? And good old toddlers. Oh, I love toddlers. Ages 1 to 3. I call these my dive bomb kids. These are the kids that have absolutely no worry in the world and they're exploring. I call these the children. It's like food in a blender, turned on with the lid off. They're everywhere, all the place, all at once. And you really gotta watch these kids, okay? And I think they're the way that they explore, I love to watch. So, ages 1 to 3, they are not as dependent on us as we used to be. And that rapid growth, like I said, slows way, 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 way down. Erickson. Erickson's all about the people around them, psychosocial, right? Trust versus mistrust. I got my bottle, my diaper changed, and no, I didn't mistrust. Erickson. Now, toddlers are mobile now. They're up, they're walking, they're crawling, they're able to get into everything, right? So it's their want to be doing things by themselves. Me, mine, don't touch, leave me alone. They want to be autonomous, automatically mine. I found it, it's mine, leave it alone. Autonomy. Shame and doubt is when you have somebody like the helicopter mom behind the child, keeping them safe, making sure they don't fall down, tying the shoes for them, helping them get dressed, and don't giving the child a chance to do it themselves. They get shame and doubt because they don't think what they're doing is good enough. Okay, do you understand that? It's mine, automatically mine, autonomy. I want to do it. It's mine, right? And then grandma and mama, oh, be careful, don't do that. You're going to fall over in here. And let me tie that. Oh, let's go get this. And no, let the child do it themselves as long as they're not going to hurt themselves. Promote independence. When you buy clothes, things that come on, off, and on and off easily are what they should be. Schedules need to be flexible, work around the child. Many days, today with the environment and the economy, you need to work or two people working in a household to make a household function. So many children are put into daycare, and it's a thing to do. So again, when a parent wants to ask you about it, well, number one, are they licensed? That's the big thing. Are they licensed? And do they meet your needs? Are they open when you need them? Do they have the facilities that you need, et cetera, et cetera? Are they close enough, et cetera, et cetera? So again, toddler, they want your approval, but they don't want you to tell them how to do it. So the goal is to teach, not to punish. It's hard. Infants are into everything and they want to figure things out. And again, as a nurse going into a toddler's room, now, big woman, and I used to get along with the kids really well. Because number one, I used to dress in all those crazy colored uniforms before they went to a uniform code. And they just used to like the bright yellow, the lime greens, the oranges, and whatever I had on. And, I was less threatening. I would sit below them. And then I would start out with stickers, or I'd start out with something, and gain their trust and start playing with them. And when I did those things, these children didn't feel as overwhelming, and now they're going to follow me all over because I like her, and they're going to follow me everywhere. Now, again, timeouts, limit setting, same thing. 1 minute per year of age. Tell them what was they did wrong and when the clock's going to start. Injury prevention, again, they're into everything. Be really careful. They're curious. They're mobile. Small pieces. Be careful. Now, the federal government does have some guidelines out for preventing injuries. Have you ever bought jammies and it says they're flammable? There's those little tags on them today that will tell you non-flammable sleepwear and whatnot. I started noticing it. I didn't notice it with my kids, of course, with a grandson that I just had that was close to me. Make sure there's childproof caps on all the medicine bottles, and they'll get into them. The other thing we don't think about is those water heaters. You can turn down the heat so it's not so hot. So if they go in there to wash their hands, brush their teeth, and they have it on hot and now it's burning, they're not going to be burned. So be careful with those water heaters. Carbon and smoke detectors, important. Get those kids out safe. And again, a flat space in infants' cribs with nothing around it. I used to have pretty bumper pads and all sorts of things, and all of those things could have hurt my child. It should be just a bed. And of course, we've already talked about car seats. The physical development on the toddlers, as I said, they're not growing as quick. They are growing slower. But what they're doing is they're getting more and more mobile. And they're getting less pudgy, they're getting longer, okay? And they're getting less that awkward, gawky sort of running going on. Toilet independence, as I said, bowel starts before bladder. It's what the book talks about. It's somewhere about 18 months. And remember, all kids are different. It's going to be complete somewhere by 3, somewhere 4. As I said, some kids at 1.5 years are potty trained. It all depends. Does that make the one potty trained at 3 less dumb or smart? No, it just means they weren't ready yet. So toilet independence is important, and we teach them. And of course, front to back, et cetera, or we're going to have a lot of urinary tract infections. Sensory or motor, oh my goodness, here we go into Piaget, right? So what is Piaget all about? This is trying things, making mistakes, and then trying again. This is that repetition of trying to make things work. This is remembering that when I did this didn't work. And remember, oh, I did that, but that worked. So let me try. Others don't forget a thing. They don't. And they'll go back and look for that toy or look for things going on. Their speech. Now, they understand more than they can express verbally. And they get frustrated when not everything is understood. But again, it's giving the child a chance to express themselves, and asking them questions, and I know it's difficult. So telling the kid, I'm sorry, I don't understand. Do you have another word or another way to tell me that? Or show me, let me take your hand. And the kid will get his point across. But 2 kids in the same room don't speak the same language. They'll play together, right? They know what each other wants. Well, they can show me what's going on too. Now, autism is usually not diagnosed till 2 years old. Before that, we might see some signs or symptoms that can show you that something's going on. But that's not going to be made until 2 years old. Again, that Denver screening test Has not to do with autism. It has to do with need for therapy. It's not showing IQ, it's need for therapy. It might be part of being autistic, need for therapy. In autistic children, you're going to see their fine and motor skills, their speech, it's all going to be delayed. Okay. And again, it's not going to be diagnosed till 2. What they'll do when they suspect is start doing testing to make sure it's not a CNS problem, a hearing problem, or something else going on. All right, here we are. Milestones, toddlers, what do we need to know? Well, birth weight quadruples about 30 months. It's 2.5 years old. 50% of their adult height by 2 years old. So if your child's 2, times it by 2, and that's how tall they're going to be. Their growth velocity slows, as I said, it really slows down compared to your infants. That bow-legged pot belly is going to go, and as they get older, it's going to straighten up, and their bellies are going to disappear. Primary teeth, all of those baby teeth, going to be in by age of 3. Their front fontanelle, the anterior, it's going to close between 1 year and 18 months. Now, why would we want to know that? Well, what if it's wide open and it's 24 months? There's a problem. Is there hydrocephalus? Is there a brain tumor? It's what's going on there. So it would say, oh, we need to do something to figure out why it's still open, right? Or what if it closes at 6 months? Not enough room for the brain to grow. So both ways, either ways, are both very, very important things to look at. Throwing a ball overhand at 18 months. Christian, first time he threw it, went right past my head, barely missed it, hit the wall, went back and hit him. It was so hard. So be careful. Some of these little boys and girls can throw hard. They can kick a ball at 24 months. They can feed themselves with a cup and spoon at 2 years. You might see them feeding themselves with a spoon upside down and backwards, but they're still feeding themselves, all right? It's that experimenting, trying to figure out what works the best. And just do it. Let them figure it out. Daytime toilet training, we can start about 2. They're starting 2 to 3 word sentences by 2, 3 to 4 by 3, and they know their first and last name by 3 years old. And toddlers, me, mine, and a temper tantrum can occur when they don't get what they want. Now, what do you do with a temper tantrum? What they say is as long as the child is not going to hurt themselves or others, ignore them. Because that temper tantrum, they're trying to get attention. So you ignore that bad behavior, that temper tantrum. And this always happens in the grocery store, I swear. They see that Cheerio box with that toy in it and they want it. And I'm like, no, let's go. And they're on the floor. Well, that's their temper tantrum. I keep walking down the aisle into the next aisle. Of course, checking to make sure they're okay. Toddlers, Freud, as I said, anything sexual. Well, it's anal. Well, anal is that they're going to be able to have bowel training before their bladder. It's part of it. Piaget, they use words as symptoms, as egocentrism. You could, things that they use as stairs and they fall on it, they yell at the stairs. Trees, they can call them, they have their arms over me to cover me with their leaves type thing. Remember, it's all about thinking. Piaget's thinking. And again, Erickson is all about, I want to do it, automatically me, mine, and don't tell me how to do it. Shame and doubt. Don't do it for me. Nutrition should be about 100 calories per kilo per day. Milk should be only about 24 ounces. They shouldn't just be drinking milk. They need to be eating food too. Again, 1 tablespoon of solid food per year of life is all they need to have. And food should be chopped into fine, tiny little pieces they don't choke on. Things like peanuts aren't good. Hot dogs, make sure they're really tiny. They can choke on stuff like that. And we should be giving them little pieces of a hot dog and a broccoli and maybe a strawberry or, another type of fruit, a piece of apple or something. And we know 2 years old are going to eat with their fingers. They just love it. Little finger foods is, makes them happy. Picky eaters, your kids that don't like certain textures. A lot of times, autistic children don't like certain textures, and this sometimes is a clue something's going on there. They don't like it hard, they don't like it soft, they don't like it gritty, they don't like the green, they don't like these are things that some children can get. Again, we know that we need to keep trying to reintroduce these foods because this can turn into a feeding disorder as they get older. There's anorexia and there's bulimia and all of these things. So trying to stop it as a young child with this pickiness and these things, or slowly introduce them back. Don't just say, oh, they're not eating it and never do it again. Keep trying to reintroduce it. So Freud is psychosexual, like I said. Erickson is all about psychosocial and all about, learning how we're growing. Piaget is all about how we think, seeing something and building on that. You see a pencil, you know how to hold it, you make a mark on a paper, then they learn how to make a circle. I mean, this is all the sequence of events of Piaget. And then Maslow's hierarchy of needs. Have you seen Maslow's hierarchy of needs before? You have, okay. Remember, it starts out with basic needs. We need food, we need housing and clothing. Those are our basic needs. And then it goes up to the top, your esteem. What makes us feel good? If you have a child who's really down and you know that they can color really good, have color you a picture. Do a picture for my refrigerator. And that gives esteem back to that child, makes them feel better. Could be that distraction that they need. This again is one of those things that you can go back and click on for that. Erickson, I've already gone over it. What is on for both of them? Those are Erickson, your trust and your autonomy. And then Piaget, again, when we talk about these children, the object permanence is when the toy's still there, stranger danger. Anxiety is when they don't want mommy to leave, and again, you're learning, building blocks of learning. Again, there's another YouTube video for you. And Piaget, we talk about your children initially, they're just learning simple things. They're learning how to suck, learning how to grasp their fingers. And as they get into your toddlers, they're starting to get more magical thinking. Their animism, they made the stairs into something that made them trip, or the trees and the leaves are arms hugging them and keeping them dry. This is giving an animal to an inanimate object and making it work. And then Maslow's, as I said. All right, we did them all. Any questions so far? All right, I'm going to do a quick cahoots. Let's see. Now, what you do, if you've never done a cahoots, you need your phones. Take the camera and point it on that little UPC code in the top right. It'll take you to Kahoot.it. And you can sign on with your name. Now, I don't go back and look at who got what wrong, what right. This is an immediate testing of the knowledge of the information I just gave you. It is also stuff that I just can't put everything into a Kahoots. So it is that extra stuff in here too. Kahoots will help you in this course. We've taken a lot of time on them. Who else is coming? We need some more people. Thank you. Somebody else?
For some reason, it's not letting me scan a QR code. It keeps trying to scan faces.
Kahoot.it on your Google. Kahoot.it, and you put in that game code.
Okay.
You good now? Good job. All right, let's go ahead and get going. I think there's 30 questions. We'll be about maybe 20 minutes. We'll be out of here.
Oh, I didn't get the code.
I'll give it to you again. Hold on. The nurse explains that permanent teeth begin erupting at what age? The code pin is 6989795, Whitney. 6989795. So permanent teeth start coming up about when you go to school, right? And that's about 6 years old. Now, it doesn't mean every kid at 6 they start losing teeth. It could be later on, right? And sometimes earlier. But the book, 6 years old, is about the time. What age range is considered infancy? Infancy is at 4 weeks to 1 age. Neonates are the first 4 weeks of life, 28 days. Okay. So neonate, 0 to 28 days old, or 4 weeks. And then infants is 4 weeks to 1 year. You need to know that by the name neonate infant. All right. Remember that. A mother's concerned that her second born is not reaching milestones as quickly as her first child. What is your response? What would you tell her? What did I tell you about children? They're all unique, right? They're all special, they're all different. And no kid is the same. And that's why I loved them, because I really had to use my assessment skills well. So the norms can vary greatly for an individual child. You have children that are 7 months that are walking. My children never walked. And all of a sudden at 15 months, they ran. They never walked. So as long as they're progressing forward, it's okay. And this is things that we can explain to that parent, calm her down. What food might cause botulism if given to an infant? This is something that some grandparents think helps with constipation. It help make a infant stool, and it can be extremely, extremely dangerous. Should not be given before they're 2 years old, and it's honey. Honey, is it pasteurized? Where was it stored? Is it proper stuff that's gone on? How long has it been in your cupboard? I mean, all of these things. Honey is very dangerous and should not be given. It's up to 2. Some books say 1, but I'm going to tell you 2. What characteristic of physical development best describes the development of an 8-month-old child? What should they be able to do? By 8 months, they should be able to sit alone unsupported. That's a question that you see a lot. Turning over completely by 6 months, right? Those are a couple ones that you will see. Which milestone would the nurse be most concerned with for a 12-month-old infant during a well child checkup? So concerned, you're upset, something that's not right. Which one is it? So again, it's reading the question. 12 months old, something that concerns me. What should you be able to do by 12 months old? You should be able to attempt or to walk. They should be pulling up to a sitting position, sitting unsupported at 8 months old. Very good. Di. What techniques should be used to soothe the irritable infant? So if they're irritable, you want to do everything calm, right? We don't want to change them frequently. We want to leave them alone. We want very calm rocking, nothing vigorous. Give them that pacifier. Non-nutritive sucking is a pacifier. And then that swaddling with their hands up here, they feel really comfortable. Very good. Parachute reflex usually appears in an infant at what months? That means when you take and you turn them around, put them face down to go into the crib, they put their arms and their legs up, like the cat. When you drop them, they always go to their hands and their feet. Infants tend to mimic that. We call it a parachute reflex. And that's about 9 months, okay? That means they're getting more control of their legs and their arms. 3 months is way too early. They're just lifting their head there. They don't have arm and leg control yet. Parents of a 2-year-old child report that he is inconsistent and frequently says no. 2-year-old child is a toddler. He's inconsistent and he says no. Is that normal or not? Remember, the me, mine is absolutely negativism. It's absolutely what a toddler is. Toddlers can be difficult in that regard. Me, my, mine. At what month do toddlers usually recognize sexual differences? Toddlers. Well, sexual differences, I'm saying, what would they even consider that? This potty training time where mommy goes to the bathroom, daddy goes to the bathroom, the child's coming in and they're going to come in and look at you, right? So when it's about 2 years old when this is all going on and they're understanding, why does mommy sit and daddy stands up? These are things that you hear. What is the cause of most childhood deaths? Is actually accidents. And by accidents, it's actually motor vehicle accidents. You know, the most childhood deaths, as SIDS deaths, is actually way down today because we're doing back to sleep. But accidents, motor vehicle accidents, whether they're in the car, inappropriately put in a seat, not put in a seat, or and it gets up to your adolescence where now they're driving and doing crazy things with cars too. It's accidents. According to Erickson, what is the correct stage of development for a toddler? Remember toddler, me, mine. Whenever you see toddler, you should think that. Remember, automatically me, mine, autonomy. I want it. Let me be. No, mine. And then it's please let me do it myself. Let me put my shoes on. Let me get changed. I want to do it. I want to figure it out. Oh, I can't. Oh, gee. Should I? Could I? Would I? So autonomy versus shame and doubt. Let the kid try. What guidelines should parents of a toddler follow when feeding solid food? So remember, toddlers, they're not growing as much, ages 1 to 3. 1 tablespoon of food per year of age is all they need. and it's hard for some parents to realize that's all that they do need. And it's something as nurses that we can explain. And how would we know that that's enough? As long as they're gaining weight and they're getting taller on every visit, the child is eating enough. Cognitively, developmentally, they're alert and where they should be. The child is eating enough. Nutritionally, they're getting what they need. Okay. So you do have information you can tell a parent. What type of play is typical during the initial toddler years? What do toddlers do? Again, toddler, me, mine. It's called parallel play. I've never mentioned pretend play. It's never been any word I've used. Parallel play is next to each other and they don't share. Cooperative play is two or more children playing together, and then there's a goal, whether it is building a castle, making a train track, whether it's making a house of blocks, cooperative play. Toddlers are all about, I'm next to you, but don't touch mine. They are mine. Me, mine. One of the things I'll warn you against, and it's very easy and to fall into the trap. If you've never heard a word, don't expect that to be an answer on an exam. Okay? If you've never heard of a word, it's not going to be the answer. A multi-select. Which characteristics are displayed when a child experiences separation anxiety? Again, you are going to have this in a discussion question, go in it further. I mean, just don't go and cut and paste this one. This is something that you're going to see mentioned in many different ways on the quizzes and the exams and the HESI. It's one of those things that they like to hit. So there's 3 stages: that protest, screaming, yelling, crying. Then they all of a sudden go into despair, where they regress, suck their thumb, become incontinent when they're potty trained, and then detachment. Finally, the parent comes in and they don't want to pay attention to them because they don't want to be hurt again. Attachment is not one of the 3 stages. What is the most important nursing intervention to promote a positive hospital experience for a 1-month infant? Do you have to worry about a 1-month-old infant in a hospital stay? You'd be surprised. I worked in newborn ICU 15 years, I would say, altogether. And then, of course, cardiac ICU, which is also a bunch of, your newborns also. Little infants can wrap you around your finger very, very easily. And they really know who you are. So, one of the things with any child that can really help with them is to provide that constant caregiver, that same sort of person that they'll see every day. And something, infants 1 year and older do know who you are, and they do respond, and you'll be very surprised. Don't underestimate them at all. What are the best foods for the nurse to recommend for a 2-year-old child diagnosed with mild constipation? Well, remember, 2-year-old, we're toddlers. We're going through potty training. Part of potty training is, yes, they can become constipated. What is the best way to treat constipation? It's with some sort of diet. Give them something before medications, etc. Shredded wheat is fiber like crazy, and cooked prunes, you couldn't get anything better for constipation, okay? So that is something. Actually, black beans you could use, but it's not the rice. The shredded wheat and the prunes is the best answer. A group of children are observed play in house, each assigned a specific role of mommy, daddy, or child. At what age do you think this happens? So remember that cognitively, they have to know their surroundings. This is usually by preschoolers. And this will be a next week's type of question, but it's a question to show you that finally, preschoolers now are starting to do playing house, right? Mommy, daddy, kid, et cetera, et cetera. All of us have played house at one time. For how many weeks will the infant experience passive immunity from his or her mother? Passive immunity. It means mommy gave you that at birth. And that's about at 12 weeks. That's about at 3 months old. Now, when do we start giving immunizations to our infants? Well, we give hepatitis B at birth, and we give immunizations at 2, 4, 6 months, and 12 months. So by the time mommy's immunity wears off, I've already been covered by those really bad diseases with those immunizations. Okay? A multi. Which characteristics are present in a well-nourished child? You know, it's really interesting with kids. You can look at them and see, are they well appearing or sick appearing? You know, it's easy. A kid who's well is up around and moving and walking, and you can't keep them still. A kid who's well nourished is going to have good shiny hair and regular bowel movements. A protruding abdomen, no, it's yes, it's a little larger, but it's not protruding. And of course, pale mucous membranes, would means they're anemic for some reason. A newborn infant will typically lose 5 to blank percent of his or her birth weight by day 3 or 4. How much did I say it goes up to? So it's 5 to 10%, absolutely normal. And then they'll gain it back and start gaining it and gain a lot. But what does self-feeding help to develop in the toddler? Well, what are toddlers all about? Toddler, me, mine, mine. Which one of those describes that? You see how this can be really easy when you take a word, figure it out, and all right, sense of independence. Autonomy, mine. Yes, sense of independence. Very good. Why is the 4-year-old child likely to obey rules? And this is now going into preschooler. They're aware more of their environment. They're also now starting to be aware of morality, right and wrong. And school-age children want to please adults, but preschoolers do not want to be punished. Preschoolers understand reward and punishment, okay? Very good. What is the earliest age at which an infant is able to sit steadily alone? You guys know this one. And yes, that is 8 months. I'm going to try to speed this ahead for you. What is an abnormal finding in the evaluation of a 6-month-old child? Abnormal. What should they be able to do and can't? Well, 6 months, they can't sit alone. Increase 1 inch in 2 months. Weight of 4 to 7 ounces a week, normal. Oh, but look, they can't hold their head up. By 3 months, they should be holding their head up. How many hours should toddlers be able to stay dry for the nurse to suggest that they are ready to begin bladder training? You know, usually young children tend to dribble, here and there. By the time they become toddlers, their bladders are getting bigger. If they are keeping dry for 2 hours, they say that they're ready for bladder training. How many minutes should a 5-year-old be in timeout? Five-year-old should be 5 minutes. What type of family consists of two parents with children from previous relationships? Remember, a family is whatever they tell you it is. As I said in the beginning, it was my daughter, my husband and I, and the grandson. Grateful to say that she's married to a wonderful man now, a beautiful husband, and another child on the way after 4 years. Blended is when you take two together. Nuclear is when one parent stay together and have children. An infant who weighs 6 pounds, 12 ounces at birth should weigh what at 6 months? £13.8. Remember, 6 months, you double. So 6 plus 6 is 12. 12 plus 12 is 1.8. So it's 13.8. And they triple at 1 year. And last question. What's an example of a proximal distal development? So it starts with the arms before the hands. It's that coming in and then going outwards type of development. Right, let's see how we did tonight. Gigi, good job, Gigi. Davina, good job, Davina. Who's number one? Fry, good job. And Whitney and Andrew, thank you so much. It's the end of your first class. I'll be posting this up as soon as I can get it out to you. As soon as the recording does download. Any questions, any comments, any concerns, just let me know and I will help you through this. You have a discussion question due, and next week you have your first quiz. You have week 1 handout. Please review it. That's your quiz, okay? And we will do it first thing. So nice meeting you all. Have a great evening, guys.
Thank you.
Good night.
Good night.
Bye.